Hi, everybody, and thank you so much for joining me again today. Once again, apologies that I missed yesterday's session. It is the nature of my work, but I'm also mindful that I want to continue to offer weekly Wednesday little mini workshops with topics preferably that you suggest or that I think are going to be of value to you. So today's session is actually recorded. And in the weeks to come, if I think that I'm going to be called out for a birth or not able to make the set time, then I will try and make sure that there is a recorded session that I can upload for you, so that you know that every week you're getting a little nugget of something that's hopefully going to help you with your pregnancy and your birth. I want to thank Luzanne for suggesting this topic, because it's not something I would actually have thought of, and yet it's really relevant. Because the other thing I want to do is continue my focus on how to have a safe and gentle and positive hospital birth. Okay, as you know, I've now moved into a home birth practice, which is just beautiful and completely different. But I know that the majority of women are still giving birth in the hospital system, whether that's by choice or circumstance. And so my focus will continue to be on helping you to make the best of that situation and how to be an active participant and be proactive in your care. Luzanne is a birth worker herself, so she knows the restrictions, and I'm sure that that is why she suggested this topic. So I know I'm going to try and structure the talk so that it's beneficial for both birth workers and for those of you who are pregnant and using this information to prepare for your own birth. And if you don't have a doula, then I highly recommend getting one, because it's exactly the kind of thing that they will help you with, and how valuable this can be, because this is what they do. Okay, this is the stuff that they learn, and they have a really deep understanding of it, and this is how they can help you. So in saying that, let's get to it. As you saw in the little promo picture that I made, I had an image of hospital beds that are quite fancy. Now, most labor wards have really fancy beds that move into all sorts of configurations, that allow the back to come up so that you can sit semi-upright, that allow the bottom to come away so we have more access when you're giving birth, that have little steps for you to place your feet on, handles for you to hold on, reaching up behind you, a bottom that tilts up. So there's all sorts of configurations to those hospital beds, and it's great to know those, and it's great to be able to use them, all right? And that is what I'm going to cover today. But at the same time, I also want you to understand when and how to use those effectively, and also not to think that because they have that very fancy bed that you need to spend time in it, even though I know that in a hospital environment, they do like to control things, and they like to have you in the bed where you are more easily controlled. And that's why they have those fancy beds. But I don't want that fancy bed to lure you into a false sense of safety and security, because the best place for you to be the majority of the time, depending on how you feel, is actively moving and allowing gravity to create space and to help move the baby down. And to have the freedom to move and change position and not necessarily be confined to your bed. In the event that you are, then we're going to use that bed effectively. But however you use it, it's not about moving into a fancy position for the sake of using a fancy position. It's about using the bed to move into a position that opens the pelvis and creates space and helps you or your baby to become unstuck. Okay, because that if we're changing position, it means that we're doing so to allow your labor to progress. Everything in your labor is about allowing that labor to progress, allowing your baby to move down through the pelvis, through the birth canal, and be born. Okay, and the positions that you adopt during that time is going to allow you to do that. And I don't like to use the word stuck, but I'm using it because I want you to understand the difference. So if I had to put my thumb and forefinger together and press them really to squeeze them together, that would feel stuck to me, okay? In order for that to become unstuck, I just have to release the tension on my two fingers, and I can now gently move the finger over the over my thumb. So I didn't have to separate them or do a big movement. All I had to do was release a little bit of tension, and in doing so, allowed that movement to create space. And very often in your labor, it's the slightest movement or adjustment that can make a big difference and create space for your baby to move through the pelvis. And for the moms who are listening or are pregnant, all of this is part of your preparation. So learning these different positions, it's not just about knowing what position you will be in during labor or what position you think you might want to be in when you give birth, because you don't know how you're going to feel. So there isn't one perfect position. Really, it's about getting to know your body during pregnancy and doing lots of different exercises and movements to get to know your body and to create space and stretch those muscles and ligaments to make sure that there's no constriction anywhere. Okay, and I highly recommend a program called Spinning Babies, which will show you a couple of exercises that are necessary to do daily, some that you do weekly, and other positions that create space and loosen those ligaments. Ultimately, you want to be able to map your pelvis, and I'm not going to do that in too much detail because it's another whole session. So what I'm covering in this session is really just the inlet, the mid-pelvis, and the outlet. As the baby moves down through to the outlet, we want to make room in all directions because the outlet is the smallest diameter, okay? But we have got movements in the coccyx, and we can also make movements by opening over here with positioning. So the object of all our positioning is to create space in the inlet, the mid-pelvis, or the outlet by changing our positions, okay? Now, if you do find that you're in a situation where you're being told to stay in bed, whether that's because it's just the hospital policy or because they need to do an intervention or a CTG or any procedures, or maybe just because you're absolutely exhausted, it doesn't mean that the baby's not going to come down, okay? You can still create space and make sure that there's no internal tension to do whatever you can to create space for the baby. And that might just be by changing position, so lying on your side, lifting up the leg, putting a pillow between the knees to create space in the outlet as well. And of course, there is an advantage to lying in bed because you don't have any muscle tension from the weight bearing of standing up. While you're in bed, you can align the body with the make sure that there's good alignment between the torso and the pelvis. Adjust your legs to make sure that there's no constriction and to create space in the pelvis. And intentionally relax the bum muscles, the thighs, the inner thigh, the pelvic floor. Use the directed breathing to send relaxation into those muscles so there's no internal tension. Once baby's in the mid-pelvis, by then you're usually in a good active labor pattern, good regular surges, and moving into different positions can feel more uncomfortable and you might need a little bit more encouragement. Now, in the event that you're in the hospital and they want you to be in bed and unable to move around, we're going to have to find positions to facilitate that movement and keep your pelvis nice and open. So what we can do is a side lying position, and making sure that in a side lying position you either have what we call a peanut, which allows the create space between your two legs. So rather than your legs just lying on top of each other, we're creating space and allow the baby to move. And if we're lying on the side, then we're also not constricting the movements of the pelvis of the coccyx. One of the things that can be done in the bed and that a supportive birth partner will help you with is what we call a side lying release, and that's done together just to also once again create space and to loosen up any tension that there might be in the ligaments that support the uterus, okay? I'm not going to go into that in this session. It's more for the birth workers who might know about side lying releases and who will help you with that. And they might also do something that we call rebozo sifting, which is difficult to do in the bed, but not impossible. Just means and that all that does is once again just creates a little bit of space and encourages movement, all right, and releases tension. That's a big thing about releasing tension. As your labor progresses, we obviously want to focus on positions that create space in the outlet. and positions that will create space in the outlets, depending on the shape of your pelvis, could be squatting, making sure that your feet are flat and the knees are over the ankles. Now that can be done on the bed, or the bed can be adjusted to allow the same configuration of your pelvis without actually squatting on the bed, maybe just having the ankles over the side, but your weight is still supported, but you can move forward into a position that opens the outlet. What I recommend for pregnant moms is that you visit the labor room where you will be giving birth and meet one of the midwives. You probably won't meet all of them unless you go several times because they work shifts. But if you ask for a tour around the labor room, or just to have a little peep in, so that you can see what kind of bed that they have, and engage in a conversation with the midwife and ask her how the bed adjusts and moves, so that you can get a picture in your mind of what it might look like to you. And imagine yourself assuming those different positions in the bed. So with the back of the bed up, facing the back of the bed, maybe sitting up in the bed like a chair with the knees up, leaning forward with the knees wide open, side lying with a pillow between your legs. So go through those different positions and imagine yourself in them, and then speak to your birth partner, and then do the work so that you understand the pelvis and the movements of the baby, and how adjusting your position can create more space and allow your baby to move down effectively. And in engaging in a conversation with the midwife is showing that you're going to be an active participant and that you want to be an active participant. And I know that that sometimes is not what they want, but the only way we're ever going to get that to change is by continuously pushing for that. So, you're not going to back down just because they don't like it, or because they don't think that you need to be an active participant. This is your birth and you want to make it the best day of your life. And in order to do that, you're going to be an active participant. And you know that by moving the mom, you move the baby. And you know that there's no one perfect position. So you want to have the freedom to be able to move and find the position that feels right for you. For birth workers, I think it's the same thing. You face the same resistance from the hospital staff, that you coming in and you supposedly know everything and you're suggesting all these crazy, weird positions. But once again, we keep doing, and the change eventually does happen. You're supporting the mom, and very often a doula who is well trained and understands all these movements can change the outcome of a birth. And I've seen it happen where the staff are actually quite surprised because they've done something that they didn't think was possible by helping baby move from possibly an asynclitic position into a more direct OA or whatever it is, but allowing that baby to move past of what they thought was a stuck position, purely because you created space. And the only way we create space is by releasing tension, internal tension, external tension, and creating space in either the inlet, the mid-pelvis, or the outlet. So, once again, I think the reason I want to do these weekly sessions is because there's so much, and I don't want to overwhelm you with it. I want to give you little snippets that gives you enough to understand. I am busy putting together another course, which is specifically about how to have a positive hospital birth. And I will be releasing details of that over the weeks. And this is the kind of thing that we're going to cover in more detail. But in the meanwhile, I'll keep doing these, and I hope that it helped. Please leave your comments or any questions that you have, because that really does help me to tailor the information in a way that works for you. I do try and make it as understandable as possible, but I also forget sometimes what I know and what other people don't know. So if let me know, please feel free to give me feedback on that. I hope that it helped, and I'm going to try and find some images that I can add to this, and then I will see you next week. And please feel free to add your topic.